say this because I am a member of the media, but it pisses me off that we have 750,000 Americans in the United States of America not accessing AIDS treatment. Many of them know their status. Some don't. 1 in 5 doesn't. So some portion of that, 750 doesn't know they're positive. But if we had 750,000 Americans with SARS and we had treatment that could simultaneously stop the spread of the disease and make those people well, and we were not administering that to those people or not finding a way through the barriers to care, that would be front page New York Times news. And that this isn't speaks to the need, I think, for fury. And I think that we have become complacent as a community, honestly. And I also think that we have to be honest about what it takes to make it politically uncomfortable for people to ignore us. And it isn't pretty, and it isn't comfortable. And I'll tell you, when I sit on Capitol Hill, it is not fun, to try to make someone do what needs to be done. And you want to be liked, it's human nature. But that doesn't get it done. And tens of millions of people's lives hang in the balance. So I'm curious, and I think we need to be angry. And I think we also do need to be self-reflective as a community and see what we can do among our community and talking to ourselves as cops. I agree with you.
I was sitting here, as you were talking about your reader, some of which I could really relate to Cornelius, and I could totally see your point. And I do, when I think about trans people, I do think they have a responsibility, for showing up, demanding their right to good treatment, and accessing that treatment. I also think that we have a responsibility as a society to make sure that when those trans people show up, that they're showing up to clinics. They're not going to call trans women sir at the front desk, and are not going to make them fill out forms that invisibilizes them, and are going to have bathroom facilities so that they can relieve their bladders when they need to, when they're waiting in that clinic, waiting 2 or 3 hours to see their physician, and then that they are going to be respected in that site. Because even, I spoke about this earlier today, even in a place like San Francisco, where we like to think that we're doing such a great job of reaching out and engaging with trans patients and, providing them with the care that they need, we have a handful of sites, I would say, 7, 8 clinics that have large trans panels of patients in San Francisco. But even in San Francisco, where, the overall trans epidemiology tells us that 2% of the HIV positive cases are trans people, 7% of the deaths are trans identified people who are dying because they don't feel comfortable in those clinics. We haven't done an adequate job creating that space. And so I think that, yes, patients have responsibility, trans people have responsibility to go in, seek the treatment. We also, those of us that are able to kind of advocate for greater sensitivity and greater awareness about trans people's needs, also have a responsibility to make sure that those, the funding dollars are going to provide a system of care that is really responsive to the needs of those patients they're trying to serve.
There's been a fracturing of the media with social media, from mainstream media, to all types. You mentioned, I think what you mentioned media just now. Is there AIDS fatigue in the media? Not this week, of course, the Post had a big pull-out section, and other people have done all kinds of stories. My station's done stories. But I get the sense in other times of the year that there's kind of an AIDS fatigue. Oh, well, we've done that story. We did that story. Oh, we did that story. Until you find out it's 3 or 4 years ago. But is there in the media, what can be done, I guess, to make the media be more aware of the issue? Because some people think it's got to be just another disease. And they just treat it that way. Again, except for this week. Who wants to bash the media? And I can't do it because of my paycheck. But I might do it.
There are a lot of media vehicles we need to put it back on the radar, but we also need to educate members of the media who are just people, and many of them are younger, and many of them don't know about HIV/AIDS. So engaging with young health reporters, the young medical reporters, and helping them understand the complexity of the disease. I hear a lot, this is a complex pandemic. It's hard to write about if you don't really understand. The science is a little bit tricky. So I think those of us who know, it's like with anything, we need a legacy plan. We need to, we do a lot of work at PAWS, working with a lot of outlets and trying to get young journalists excited about this issue, and also show them where there's news. I think that's the thing. They're always looking for a hook. I mean, this is what I do every day. How do you get people to come to your site? How do you get people to pay attention? But there's an aversion to good news, and we have a lot of good news needs now, and so I think we have to help make it okay to write the good news about it. And it,
Media comment? Well, we talked here adamantly about young people and the phone calls we got. What about older people who think they have lived long enough that they won't be infected? Well, you want to go back?
Yeah, I do want to go back. Because I think Regan is right, and I think that we also have to get our messages right. But I want to say that there is a lot of coverage, and there are a lot of outlets that write a lot about it. But there's also, I think, two areas that we have to really focus on. One, in the gay media. I think that, to me, it's criminal that you would have the most well-documented disease occurring to a population and is still a leading cause of death in that population, and that its media would not be so doggedly on it. I mean, it's just, that's just really, fundamental. And I recognize that we have a lot of issues in our community that we want, that are important. Marriage. I mean, I chair our process in Washington, to really create a framework for how we move forward with same-sex marriage. So I think that we can, like as the president says, walk and chew gum at the same time. But I also just think we have to think about, well, why is it that our media doesn't cover this? And I think that this is particularly important as the country, as this disease so concentrated among young black gay men, that they don't have to make a false choice between their activism around HIV and activism around being gay within a gay context and establishment that seems not to care about their lives. And because that will have tremendous consequences down the road as this country especially becomes blacker and browner. So I think that the other question that we have to ask, is the inaccuracy of media. And for that, just getting the facts wrong. Media that reports that we have, that the medicines are a cure, that when they're not. I mean, we're lucky that we now have a proof of concept of a cure. And I hope Tim Brown here doesn't mind my recognizing him, but Tim Brown, the only person in the world who swept under the carpet. The reality is we have an epidemic that's 75% male, and most of those men are gay men. And we keep framing the epidemic as anything except about their lives. And that's wrong. And the media is misinforming the American public.
It's just not the LGBT media, it's also our LGBT institutions, our representative institutions. If there's an LGBT institution in this country that does not do more than just have a World AIDS Day event once a year, that isn't out there testing, that isn't out there conveying prevention messages, that isn't providing information about where to seek treatment, they're not doing their job. Because this epidemic continues to kill our communities,